Right. Good morning, everyone. Last week, we introduced the first type of tissue in the body, epithelial tissue. Remember, epithelial tissue is a type of body tissue that covers or lines. In the integumentary system, we learned about epithelial tissue that will cover or line body parts. And then the integumentary system, of course, we talk about the integument, which is the largest organ of the body, the skin. Epithelium is a type of body tissue that forms the covering on all internal and external surfaces of the body. It lines body cavities and hollow organs, and it forms glands. The integumentary system is the largest organ the integument is the largest organ of the body. It forms a physical barrier between the external environment and the internal environment, and it serves to protect. The integumentary system includes the epidermis, the dermis, and the hypodermis. Those are the three layers of skin. And it also includes glands, hair, and nails. The next body system that we cover is the skeletal system. And the skeletal system consists of two significant types of connective tissue, cartilage and bone. In the embryo, the skeleton is mainly cartilage in nature. And by adulthood, most of this cartilage has been replaced by hardened bone through the process of ossification. Cartilage continues to exist in certain body areas like the nose, the outer ear, the voice box, and at the points where bones attach to one another. The study of the structure and function of the skeleton and bony structures is known as osteology. The skeletal system is going to consist of bones, cartilage, tendons, and ligaments. Bone or osseous tissue is composed of inorganic salts like calcium phosphate and calcium carbonate. The inorganic salts found in osseous tissue give bones their hardness, and bones are surrounded by a fibrous connective material. Remember, when we talked about chemistry and we talked about organic substances and inorganic substances, it's easy to remember that bones are made of inorganic substances because think of cremation. When we cremate a body, we literally burn away all of the organic materials, leaving only the inorganic parts, which would be the bones or any kind of like metal parts that were inside of the body from like surgeries and things. So there's many functions of the skeletal system. The first is support. So bones provide support and rigidity to the soft tissues of the body so we can maintain posture. Bones help to protect our more delicate vital organs. So this is our second function, protection of the soft organs of the body, like the bones of the cranium around the brain, the vertebrae around our spinal column, our rib cage that surrounds our thoracic cavity. The third function is that it allows body movement. So bones will serve as levers or points of attachment for the body's muscles. So the muscles will pull on the bones, and this will result in movement. The fourth function is that bones serve as storage areas for minerals in the body, like calcium and phosphate. If blood calcium levels rise above normal, the calcium will move into the bones and be stored there. If the calcium level in the blood falls, the stored calcium leaves the bones and enters the bloodstream to be used throughout the body. The fifth function is the production of blood or lymph cells. So hemopoiesis is the term for the production of blood cells. And blood cell production primarily occurs in the red bone marrow of the body. That's very important to remember. Red bone marrow is the site of blood cell production. Cartilage is a firm tissue that's softer and more flexible than bone. Cartilage has the ability to resist compressive forces, meaning that it absorbs shock. And cartilage also enhances bone resilience and provides support on bony areas where there's a need for flexibility. Hyaline cartilage is the most common type of cartilage. This is the type found in the ribs, the nose, the larynx, and the trachea. So your voice box and your windpipe. And this type of cartilage is the precursor to bone. There's other types of cartilage. There's fibrocartilage that's found in the intervertebral discs, so between the discs of the spine, joint capsules, and ligaments as well. And then there's elastic cartilage, which is found in the external ear, the epiglottis, which is the little flap of cartilage that prevents food going down your throat from going into your windpipe, and the larynx, which is your voice box. So two things important to know, the difference between ligaments and tendons. Ligaments are a type of fibrous connective tissue that connects bones to other bones. Ligaments are similar to tendons and fascia in that they are all made of connective tissue, but they're differentiated in the connections that they make. So ligaments are going to connect bone to bone, and tendons will connect bone to muscle, and fascia will connect muscle to muscle. So remember, tendons, the strong bands of connective tissue, skeletal muscles attached to bones by tendons. So bone to bone, ligament, muscle to bone, tendons. A good way to remember this is so this is your kneecap. It's a sesamoid bone, the patella. It's actually embedded in tendons. So, and muscle. See? And a ligament, see, this is the femur, which is, your thigh, your, not muscle, your thigh bone, and your tibia, which is your shin bone. The ligament connects the bones. Joints or articulations are a point of union between two bones or cartilage and bone, and all the bones in the body except for the hyoid bone will articulate with other bones. The joints of the body are often categorized based on the relative amount of movement that exists at the joint. So we'll return to this after midterms. We'll actually talk about the different types of joints and the movements that can occur at each junction. But for your midterm next week, we're covering only what we have already gone over. So it'll be your first exam plus tissues and the integumentary system and the skeletal system today. So let's talk about bone histology for a second. Remember, histology is the study of tissues. So we're just going to talk about bone tissue for a minute. The bone matrix is the part of the bone tissue that forms most of the mass of bone. It's comprised of organic and inorganic substances. The organic component of the bone matrix is going to include collagen and ground substance, where the inorganic component is the inorganic bone salts, mainly hydroxyapatite. The inorganic matrix contributes approximately 65 to 70% of the wet weight of bone. It's also an ion reservoir, so it stores 99% of the total body calcium, 85% phosphorus, and between 40 and 60% of the body's sodium and magnesium. The deposit of mineral salts like calcium contributes to the hardening of bone, and this process occurs over a period of years until a person's bones have become fully developed. And the process of bone formation is ossification. So there's different types of bone cells. Osteoblasts, for example, are your bone forming cells. The primary role of osteoblasts is to lay down new bone during skeletal development and remodeling. Through this process, osteoblasts directly interact with other cell types within bone, including osteocytes, which are your mature bone cells, and hematopoietic stem cells. Osteocytes derived from osteoblasts or bone-forming cells are essentially osteoblasts surrounded by the products that they secreted. They respond to mechanical strain and send signals of bone formation or bone resorption to the bone surface to modify that microenvironment and regulate both local and systemic mineral homeostasis. And then osteoclasts, these are bone destroying cells. It's a specialized cell that absorbs and removes bone. And this is to allow for the development of new bone and the maintenance of bone strength. There's two different types of bone formation. There's woven bone, where the first type of bone osteoblasts form during ossification. It's weak, so this is a precursor type. It's remodeled into lamellar bone, which is mature bone organized in thin concentric sheets called lamellae. This is an example of that right here. The outer layer of bone is dense and referred to as compact bone. Compact bone contains small cylinders called osteons or Haversian systems. And the center of these osteons will contain tiny canals, Haversian canals. And this is where blood vessels, lymphatic vessels, and nerves travel through. The interior part of most bones will consist of a spongy or porous type of bone known as cancellous bone. It contains many spaces that are occupied by red bone marrow, and it's responsible for manufacturing red blood cells. Spongy bone will provide strength. It doesn't add a lot of weight, and it can endure a lot of physical stress. In addition, important to know, bones are covered with a tough outer membrane called the periosteum. And there's 4 different types of bone shapes, which don't include sesamoid or sutural. So long bones are longer than they are wide. And these are going to include the arm bones, leg bones, and finger bones. These bones act as levers by allowing movement of the bone through the action of muscles. Short bones have equal dimensions in all directions and are suited to allow for flexibility. So short bones will include the bones of the wrist and the ankles. So carpal bones are your wrist bones, and tarsal bones are your ankle bones. Flat bones are thin or curved bones like the breastplate or the sternum, the ribs, and the scapulae, which are your shoulder blades. It's plural. Scapula would be one. These allow for attachment of muscles, and they also create the rounded shape of the head and chest. The fourth type is irregular bones. These are just oddly shaped bones that allow structures to pass through them, and they provide a source of protection. So this is going to include the spinal bones, facial bones, and hips. Whoop. And then we have sesamoid bones. These are a specific type of bone embedded into tendons. An example of a sesamoid bone is the patella or the kneecap. Um, it's given that name because it's shaped similar to a sesame seed. Now, obviously, the patella is a lot bigger, but that's just where the name originates. And then we have sutural bones. These are also known as Wormian bones. These form between the sutures of the skull and fill in the gaps between the cranial bones. This is the structure of a long bone. A long bone is the bone we typically think about when we think about bones. Um, a long bone is made of the diaphysis, which is the shaft of the bone, the epiphyses, which is the plural word. There's a distal epiphysis, which is going to be the distal portion of the bone. So the bone, the end of the bone away from the point of attachment. Okay, remember, distal means away from the point of attachment, and the point of attachment is where that limb attaches to the torso, right? Okay. And then the proximal epiphysis. So this is going to be the portion of the bone closest to the point of attachment. So if we're looking, let's say, at the humerus, this is the superior part of the humerus, proximal, because we're specifically talking about it attaching to the body. And then the distal would be towards the elbow, right? Away from the point of attachment. Okay. So long bone, the diaphysis, the epiphyses, which are the ends of the bone, and then there's articular cartilage around the ends of the bone because this is where it will articulate with another bone. And that's going to cover and cushion the end of the bone. It's going to form a joint. And then we have the medullary canal or cavity, which is inside of the bone. And this is where yellow bone marrow will be stored. Yellow bone marrow is your energy reserves, like adipose tissue, things like that. So it's fat storage. Remember red bone marrow, which in the adult body is going to be relegated to specific sites. That's going to be the site of blood cell production, and yellow bone marrow is your fat storage. All right. So that was the structure of the long bone. This is the structure of flat, short, and irregular bones. So these bones will have an outer covering of compact bone, and then it surrounds spongy bone. Whoops. With aging, the bone matrix is lost and the matrix becomes more brittle. That's why it's easier for older people to break bones. So the spongy bone loss will result from thinning and the loss of the trabeculae. Compact bone loss occurs from the inner surface of the bones, and this is because there's less formation of new bone cells, so there's fewer osteons. This will lead to increases in the risk of fractures. It could cause deformity, loss of height, it causes pain, stiffness, and loss of teeth. Uh, Exercise and dietary supplements are effective at preventing bone loss. And this is just a little review. You can find this on your slides of this portion of the lecture. So I'm going to move over to our quote unquote gross anatomy of the day. We're just talking about the bones of the body now. This is more so what, I mean, you could be asked test questions from what we just went over, absolutely. But it's very important that we know all of the bones in the body, in the human body. All right, so the skeleton is organized into two different groups, the axial skeleton and the appendicular skeleton. The bones of the axial skeleton revolve around the vertical axis of the skeleton, and the bones of the appendicular skeleton will make up the limbs that have been appended or attached to the axial skeleton. All right, on the left over here in blue is the axial skeleton. It's going to include the skull, the ossicles, which are the inner ear bones, the hyoid bone, the vertebral column, and the rib cage. So it's the central axis of the body. The appendicular skeleton is what attaches. So it's going to be the limbs and their girdles. So we have the pectoral or shoulder girdles on each side, the scapulae, arm bones, hand bones, and then we have the pelvic girdle, which is your hip bones, the femurs, the tibias and fibula, so your leg bones, and your foot bones. So there's 206 classified bones in the human body. That's a test question. 206 bones in the human body. The axial skeleton makes up 80 of those bones. So this is how it's organized. You need to know your number of bones, okay? So there's 8 cranial bones. You've learned this in restorative art. This is going to include the frontal bone, the 2 parietal bones, the 2 temporal bones, the occipital bone, the ethmoid bone, and the sphenoid. All right, there's 14 facial bones. We'll go over them as well. The hyoid is 1, 6 ear ossicles, because there's 3 on each side, 26 vertebral bones, and 25 bones in the thoracic cage, which is your rib cage. So the skull includes cranium and facial bones. Bones of the skull provide protection for the brain and the organs of vision, taste, hearing, equilibrium, and smell. These bones provide attachment for muscles that control the head and control facial expressions and mastication, which is chewing. We're going to go in order. in a minute. So we'll come back to this, but just to briefly go over frontal bone, towards the front of the body. It's also important that you know features of these bones, like the supraorbital margins, frontal eminences, things like that. Oops, excuse me. Just pulling up my notes here. And then we have two parietal bones on each side. So upper sides, two temporal bones, an occipital bone in the back, and then the sphenoid bone, which is going to help form the floor, and the ethmoid bone. All right, for nasal bones, we have two. For facial bones, we have two nasal bones, two lacrimal. Comes from the, I want to say, Greek origin, maybe, for tears. So your tear ducts, where they're kind of located. There's two inferior nasal concha. So these are going to be depressions. So concha, nasal, and inferior because they're lower. Two maxilla bones that will fuse together to form the maxilla. The one horseshoe-shaped mandible. The vomer bone, I'll show you a better image of that. Two zygomatic bones, which are your cheekbones. And two palatine bones. These are going to form the roof of the mouth. There's different features of the skull, important to know. Sutures. Sutures are immovable joints that join skull bones together. You have the coronal suture. So remember when we talked about the coronal body plane, separating the body into front and back portions. Coronal suture, sagittal suture. So remember, sagittal body plane separates the body into left and right portions. Squamous suture is lower. It's going to be in the temporal region. And the lambdoidal suture, which is posterior. Fontanelles, you'll see this on babies, especially newborns. It's very pronounced. These are spaces between cranial bones filled with fibrous membranes. This allows pliability as the baby passes through the birth canal, because it's got to squeeze through a pretty small passageway, right? So the bones have to have that extra pliability to move. But it also will allow for the rapid brain growth that occurs up to age 2. And then there's sutural bones or wormian bones, tiny bones that develop within the sutures. And then this image right here is the cranial vault. So, oh, hang on, that's the cranial floor. My bad. And there's my alarm to wake up. I've been awake. Okay. So the cranial vault, sorry, this is not the image of that. The cranial vault is the top, sides, front, and back of the cranium. So this is like if you were to cut the skull, the top half, and remove it. The cranial floor, see, you can tell it's the floor because that's the foramen magnum. That is a feature of the occipital bone, right? Because that's where the spinal cord is going to pass through from the brain into the vertebrae. So this is the bottom of the cranium. See how it's got these depressions to allow for the brain tissue. These are cranial fossae, depressions in the floor of the cranium to accommodate the shape of the brain. So anterior, so that's going to be the closer to the front of the body, medial or middle cranial fossa, and posterior fossa, or fossae would be. So this is what that looks like. The nasal cavity. These are just more features of the skull. The nasal cavity is formed by cartilage and bone. When air enters the cavity, it's warmed and cleansed by the mucus forming that cavity. Sinuses or paranasal sinuses are mucus-lined cavities inside cranial and facial bones. These help us with producing sound and our voice. So these cavities are resonance chambers that enhance vocal quality. That's why your voice changes whenever you have a cold and you have like inflamed sinuses and a bunch of mucus drainage, right? So let's go through the bones of the body. You'll need to know them definitely by definition. So the frontal bone forms the forehead, front and top of the cranium, and the upper eye sockets. The parietal bones form the majority of the upper sides and the top of the cranium. You know, in restorative art, you've probably heard like the king's crown. That's because if the crown were placed on a head, it would touch the parietal bones. The temporal bones will form the lower sides of the cranium surrounding the ears. The occipital bone will make up the lower back of the cranium. The sphenoid is inside of the cranial cavity. It's a bat-shaped or butterfly-shaped bone that will help form the floor of the cranial cavity. And the ethmoid bone, and this purple right here, it's going to make up the floor of the cranial cavity as well. It's also part of the eye socket and the upper part of the nasal cavity. All right, so let's look at this image of the ethmoid right here. So this is superior, so towards the head, in the direction towards the head. I know it's in the head. The crista Gali. That's going to be the most superior portion of it, and then the cribriform plate. The nasal bones are what we think of as the bridge of the nose. And lacrimal bones are anterior and medial portions of the eye sockets. It's lacrimal is where that word, oh, sorry, I said Greek. It's derived from the Latin word for tears. It's the size and shape of a fingernail. That's a trivia question for restorative art. The lacrimal bones are the size and shape of a fingernail. It's the smallest bone of the skull. The vomer bone. Sorry, this is a moving picture. This is the best picture I could find for the vomer bone. All right. This helps form the nasal septum. The red right there. And the zygomatic bones or the malar bones. These are your cheek bones. They're diamond shaped. The palatine bones. These are going to form the roof of the mouth. That's why we talk in pathology, we'll talk about the cleft palate, like when a baby's born and the palatine bones are there's too big of a space. That's called a cleft palate. And so it'll have to be fixed with surgery. And then the maxillary bones are the upper jaw bones. There's two that will fuse together. The mandible, the lower jaw, horseshoe shaped. Remember your features of the bone for restorative art, like the ramus of the mandible. And then we have the inferior nasal concha. Let's see. So inferior meaning lower nasal like depressions. And then on each side, so 6 total, but 3 on each side, we have your auditory ossicles. So think when we go to hear a performance, you go to an auditorium. So we're talking sound. So these are your ear bones, the malleus, which is also known as the hammer because it's hammer shaped, the incus or the anvil, and the stapes, which is stirrup shaped. The hyoid bone is located in the neck. It's isolated from all other bones. It's connected by ligaments to the styloid processes of the temporal bones. Muscles from the tongue, neck, pharynx, and larynx will attach to the hyoid bone and contribute to movements involving swallowing and speech. The vertebral column provides support for the head and trunk of the body. It protects the spinal cord. It's where it's the connecting points for ribs and muscles. It's divided into 4 regions, each region contributing to the alternating concave and convex. So concave and convex. Remember those shapes. Convex goes outward. Concave is inward. And curvature of the spine. The sacrum is the triangular bone below the last lumbar vertebra, and it's formed by the fusion of 5 vertebrae. And then the coccyx is formed by the fusion of 4 vertebrae, and it is a triangular bone attached to the bottom of the sacrum. So the different areas of the spinal cord is the cervical region, and so we'll have to know the numbers on each. So C1 through C7, and then the thoracic vertebrae are T1 through T12, and the lumbar vertebrae are L1 through L5. Then you have the sacrum and the coccyx. This is to give you a better image of what the typical vertebrae look like. So the typical vertebra has a body or a centrum that's disc shaped right here. And the vertebral arch is the bony ring behind the vertebral body. And the opening in that vertebral arch is the vertebral foramen, which is where the spinal cord will pass through. I'm gonna skip over that. All right, so as the vertebrae progress down the spinal column, the bodies will get more massive, enabling them to bear more weight. And here's what you need to know. You need to know the numbers. So the cervical vertebrae, this is going to be the most superior. C1 is the atlas. Very important to know. It's known as the atlas. C1. C2 is the axis. And the cervical vertebrae are, guess what? In the cervical region. So in the neck. It goes from C1 to C7. So there's 7 of them. T1 through T12, so 12 thoracic, and this will help form, or this is the posterior portion, but the rib cage, the chest area, going lower to the lumbar region, which is the lower back, the sacrum, and the coccyx. So one way to remember this is you have breakfast at 7, lunch at 12, dinner at 5, and maybe 2 snacks through the day. All right, and we have the thorax or the thoracic cage. This is going to include the thoracic vertebrae, the sternum, the ribs, and the costal cartilages. The sternum or the breastbone includes 3 fused bones, the manubrium, the body, and the xiphoid process. Xiphoid process is the lower tip. There's 12 pairs of ribs, which will attach their posterior ends to vertebrae. So 7 pairs of true ribs. True ribs are vertebrosternal ribs, which means they attach to the vertebral column and the sternum. So hyaline cartilage called costal cartilage. We have 3 pairs of false ribs. These are vertebrochondral, so they still attach to the vertebral column, and then chondral means that cartilage, it attaches to cartilage. And then 2 pairs of false ribs, which are floating ribs, and they don't attach to anything at their anterior ends. That is the axial skeleton. Let's just take a quick look at your syllabus because I want to make sure I cover what's going to be on your midterm. Oh, wait. $2024. Yes, okay, so we'll do the appendicular skeleton as well. All right, this one's it's pretty easy. Okay, so the appendicular skeleton is 126 bones. So we have the pectoral girdle or the shoulder girdle. That's 4 bones because it's 2 scapulae, 2 clavicles. The upper limbs, each arm has 30 bones. So adds to 60. The pelvic girdle, your 2 hip bones. And the lower limbs also have 30 bones each. So 60 total. The pectoral girdle. So each of the 2 shoulders will have 2 bones, the S-shaped clavicle and the flat triangular scapula. The clavicle attaches or articulates with the sternum and the scapula, and the scapula articulates with the humerus of the arm. For the upper limb, each of the 2 upper limbs consist of the arm, the forearm, and the hand. So there's 30 bones in each upper limb. So let's look. Humerus, the radius, and the ulna. So the radius is on the thumb side. See how this is positioned in anatomical position? So anatomical position, remember facing forward, palms forward. So the radius is going to be on the lateral side of the arm, and the ulna is on the medial side of the arm. And then we have 8 carpal bones, 5 metacarpal bones, which are your hand bones, and 14 phalanges, which are the bones of the fingers or the digits. All right. And that equals 30. And then it'll be the same on the other side. So let's go to the pelvic girdle. The hips will transfer the weight of the upper body to the legs. The pelvic girdle consists of a pair of coxal bones, which are your os coxae, your hip bones. These are going to contain 3 fused bones, the ilium, the ischium, and the pubis. The ischium is posterior. Pubis, because it's going to join to form the pubic symphysis. The pelvic girdle combined with the sacrum and the coccyx. See, here's the sacrum of the vertebral column. Will form a bowl-shaped region, which is the pelvis, and this is going to house the reproductive organs, the urinary bladder, and the lower digestive tract. And then we have the lower limb. So where the head of the femur joins the pelvis, it's known as the acetabulum. All right, then we have the femur, the patella, the tibia, and fibula. And then you have 7 ankle bones, 5 metatarsals, so these will be your foot bones, and 14 phalanges. So each lower limb is going to have 30 bones, so 60 total. Right, simple enough. A lot of things to memorize because you do need to know every bone of the body. I'm not going to make you memorize the tarsals or the carpals. In a perfect world, and for your NBE, you really should. But I will be satisfied if you just know your bone numbers, okay? And don't forget to go back and look at the specific features of the different bones. So let's see. For the frontal bone, features of the frontal bone, let me just pull up an image real quick. The different bony features. Okay. Well, right here you can see the okay, this is the orbital foramen. Let's see. I'll just Google. Let's start with supraorbital margin. So supra means above. All right. Supra means above your orbits, your eyes. So that margin, supraorbital margin. That is a feature of the frontal bone. And we have the superciliary arch. So that's going to be like where your eyebrows are. All right, kind of, you can feel it, touch your eyebrows. That's your superciliary arch beneath that. The glabella. We'll talk about that when we talk about the, here we go. Let's say, so glabella in here, in between your eyebrows, frontal eminence, the rounded parts of the frontal bone. There's two. You can also feel these as well. Let's see. And frontal sinuses. These are just, or the frontal sinus, sorry. So, when you have a really bad sinus infection, you have pain all around your face. So you have sinuses on the frontal bone. All right, and then with the occipital, you'll have occipital condyles, which are the rounded parts of your occipital bone, and then the foramen magnum, where the spinal cord passes, and then the external occipital protuberance. Let's see. Should be right there. The occipital bone. All right. For the sphenoid bone, the features of the sphenoid bone include the turcica. This is going to house, there we go. Cella turcica. And then the sphenoidal sinuses. So those are going to be the air canals in there. And foramina of the sphenoid. This is where blood vessels will pass through. For the ethmoid, the features of the bone we talked about were the cribriform plate, the crista galli, and then there's, of course, sinuses as well. So let's look at parts of the mandible. All right, so with the mandible, you have the body of the mandible. Oh, sorry, yeah, I told you wrong earlier. The body of the mandible, the ramus, where it comes up, and the angle of the mandible. The body, the ramus. All right. I think that's all of them. So you have a homework assignment. You can be working on that for a while. And I know that you also have your midterm for restorative art. So I'm going to let you go, and you can use this time to either work on your homework or um, study for restorative art. So next week is the midterm. It's on your syllabus. Everything that's going to be on it is everything we have gone over from today to the first day of class. So utilize your study guides, utilize your tag, because I will pretty much follow the blueprint of tag. All right. If you have any questions, please let me know. I will see y'all next Tuesday. We will be in person next Tuesday for your midterm. And at this point, I'm going to get Mr. Hurt to give y'all your quiz. All right. So let me know if you have any questions. Thank y'all. See you next week.